Focus on the ATL.
Welcome back to Focus Atlanta. Ronnie Bass is the founder and executive director of Someone Cares Incorporated. While he is completing his doctorate in human services, he's changing lives through his organization.
Someone Cares is African American, Latino, MSM, which is men who have sex with men, and transgender organization.
Someone Cares is one of the leading community-based outreach organizations that is able to convey messages and provide HIV, AIDS, and STD prevention, interventions, and educational information to Atlanta's Latino, African American, MSM, and transgender population.
Transgender is something that you're born with. You're born as a transgender, knowing that you are what you are.
Well, I work here at Someone Cares. I am the program director of the program called REAL-T. REAL-T stands for Reaching, Educating, and Assisting the Liberation of the Transgender Community.
Having obtained the confidence of the community in a non-judgmental way, the minority MSM transgender clients have become more open to discussions about reducing at-risk behavior, and likewise more open to invitations to attend weekly social network gatherings and empowerment group meetings.
We provide prevention and education. We do HIV testing and screening and treatment for HIV/AIDS.
Someone Cares is the only agency of its kind specifically recognizing the needs of African Americans, Latinos, and the transgender community.
As a matter of fact, we are the first African American agency here in Atlanta that is specific to African American transgenders and African American MSM. We're excited about that.
I think it's real important, especially in Cobb County, that we focus on the groups that are highest at risk, and African Americans as well, African MSMs and transgenders are at high risk. And unfortunately, because even though the transgender community is at high risk, the numbers are small. So therefore, a lot of the dollars are focused at those groups that are the larger groups that are being impacted. So I think it's real important that we don't forget those smaller communities, such as the transgender, and again, African and MSM are extremely at high risk.
The age range of those recognizing themselves as transgender is substantially younger than you might think.
When we do outreach at night, especially doing outreach, we go out on the streets and hand out safer sex kits. And we find the age 13 to 61.
Now the numbers are increasing between 13 and 29 at an alarming rate. So that's why we're trying to get out there in the college, on the college campuses and in the community. We have a youth program called HYPE, Helping Youth with Prevention and Empowerment, which Edwin Blunt is our program coordinator, and he's been very effective in collaborating with some of the agencies here in town to address the issues of the rate of HIV and STDs in the 13 to 29 age range.
Most recently, the agency is excited to announce their new clinic to the community.
We now have a clinic that is set up to alleviate some of the barriers that we have in the community, where people now can get early diagnosis of their illness. The clinic is called Someone Cares EDIC, which Early Detection Intervention Clinic. And we're excited. Our medical director is Dr. Richard Hudson. We have a family nurse practitioner on staff here to do the screening. And of course we have other staff here to do prevention and education and the counseling and testing. We're going to offer gonorrhea, syphilis, chlamydia screening, not only for the African American, MSM, and Latino communities and the transgender communities. Anyone that calls our number will be seen here.
We only have a limited number of services here in Cobb County, and those organizations do not focus on the African MSM as well as the transgender community. So I'm really excited because I think Ronnie, in such a short amount of time, has really moved forward, and he's been able to mobilize the community, been able to get the resources to be able to target this population and provide a safe space for them to be able to come to and receive the services that they need.
Someone Cares recognizes that the key to eradicating HIV and AIDS is education and prevention.
It is the only chronic illness that's associated with sex and drug use. You think about diabetes, you think about cancer, those are not necessarily associated with sex and drugs. So the issue is people just don't want to go out and get tested because they don't want to know.
The fear of getting HIV tests should be at a minimum because we don't draw blood anymore. We here at Someone Cares use the Oral Quick Advanced HIV testing kit. And all you have to do is swab your mouth, wait 20 minutes and get your results.
In order to protect ourselves, everyone must know the truth about contracting HIV.
I've always told people, it's nothing wrong with having sex, but have it safely.
You know, sex is an everyday part of life. It's something we're not going to exclude. We need to bring it to the forefront. We need to let people be comfortable talking about it, making sure primary care docs are talking about it, nurses are talking about it. Everybody's, you know, that it's just part of our everyday behaviors, and that it's, and that you can't always know what your partner's doing. So you need to be able to, you need to protect yourself, and part of that protecting yourself is making sure you get tested.
If you would like to help Someone Cares in their mission to empower minority communities at risk for or living with HIV and AIDS, visit www.someonecaresatl.org.
One of the things good about, and I'm excited about this organization, is that the fact that we can't stay focused just on the HIV. There's a lot of other social issues surrounding HIV that need to be addressed, such as mental health issues. People need to have homes, they need to have food. People really aren't as concerned about their HIV status if they don't have a place to live and they don't have food on their table.
Stay tuned for more Focus Atlanta.